Dr. Yinghua Ma has been Professor of the Institute of Child and Adolescent Health at Peking University, China since 1999. And we're delighted with that she is now a UNESCO Chair for Global Health and Education since 2022. Her research focuses on child and adolescent growth and development, life skills education, and school health promotion, with numerous leadership roles in this field, such as chairperson of the school branch of the China Association of Health Promotion and Health. She's also served as Deputy Director of the China Centers for Disease Control and Prevention and received numerous awards and honours for her contributions to child and adolescent health research and education. So, Professor Ma, our question to you for your presentation today is that China has extensive experience with school health and nutrition. How are the health and education sectors working together in China to implement an integrated approach to school health at scale and to monitor progress? We look forward to your presentation. Thank you.
Thank you, Nicola, for your kind introduction. I will screen my screen.
Super, we can see the slides, Dr. Ma.
Can you see the slide?
Yes, we can.
Okay, thank you, Nicola, for your kind introduction. I'm grateful for the opportunity provided by UNESCO and the UNESCO Chair on Global Health and Education to meet you all online to introduce the practice of a multi-sectoral school-based approach to promote students' health and well-being in China. I have prepared a few slides to respond to the question raised by Nicola, focusing on how education and health sector work together to implement and monitor an integrated approach to school health in China. Since 1979, China has established a comprehensive approach, emphasizing cross-sector collaboration, particularly between education and the health sectors. The first, clear legal and policy frameworks for the intersectoral cooperation. In 1990, with the approval of the State Council of People's Republic of China, Ministry of Education and the National Health Commission jointly promulgated the regulation on school health work, which stipulate the respective roles and the responsibility of the education and the health sectors. The regulation stipulates that the education sector is responsible for the administration and management of school health program, while health sector is responsible for monitoring and technical guidance. Education authority at all levels and schools are required to include school health in their annual education budget and integrate school health in their work plans and performance assessments. The health authority at all levels are required to organize the provision and monitoring of school health services, including health screening, prevention, referrals, etc. Currently, for education sector, the Ministry of Education has a program division to coordinate school health policy and programs at national level. For the health sector, they are the Centers of Disease Control and Health Supervision Bureaus at national, provincial, and local levels that are designated by the National Health Commission to cooperate with education authority and schools for delivery, technical guidance, and monitoring of school health services. The second, effective coordination mechanism. Within the framework of Healthy China Initiative of State Council, the education and health sectors are established a regular consultation mechanism for school-based disease prevention and control programs to formulate policies, develop implementation plans, and carry out the services, carry out the supervision and monitoring jointly. For example, the two sectors have regular meetings to review education sector responses to HIV and AIDS every year. Similar mechanisms are in place to coordinate intersectoral cooperation in response to other health threats that affect schools and students. The third, multi-sectoral advisory and technical support groups and networks. The Ministry of Education has established a number of thematic expert groups to provide advisory and technical support for the planning, implementation, monitoring, and evaluation of school health policy and programs, such as Health Education and Teaching Guidance Committee, myopia prevention and control, HIV/AIDS prevention and intervention, and etc. These groups have memberships representing all sectors and disciplines in relation to school health, including education, health, management, mental health, hospital, disease prevention, nutrition, curriculum development, teaching, and research institution. In addition, professional society in the field of education and health, such as the Chinese Preventive Medicine Association, the Chinese Education Society, and the Chinese Student Nutrition and Health Promotion Association have also been facilitating intersectoral collaboration and synergies and contributing to school health and nutrition. And finally, a national-wide multi-sectoral student health monitoring system. Since 1985, China has conducted national surveys on physical fitness and health every 4 to 5 years among students from primary, secondary, and higher education. The 8th survey in 2019 was conducted by 6 ministries and commissions, including the education, sport, and health sectors. It investigated over 370,000 students aged from 6 to 22 in 1,258 schools nationwide. And 24 indicators related to anthropometry, psychological function, physical fitness, and health status were measured in this survey. The survey is also used to collect information on lifestyle and mental health condition. These surveys have advanced the understanding of the health status of children and adolescents, promoted the formulation of policies and interventions, and also provided the basis for evaluating the impact of school health work. The content in this slide in the red box is just showing an example of the whole process. Identify problem, DC line in physical fitness, increase in obesity, increase in poor eyesight. and then formulate some policies like strengthening the young sports and enhance youth physical fitness. The State Council made this policy, and after that, putting forward a series of measures and requirements, and then evaluation through this monitoring data. However, the following up surveys found obesity and myopia still increasing, and students affected tend to be younger. The government responded by re-releasing the implementation plan for comprehensive prevention and control of myopia and obesity in 2018 and 2020, respectively. And these are all of my sharing. Thank you very much for your listening and patience, and thank you for the invitation to this webinar. Thank you.